Welcome to this structured overview of urethral catheterization, covering the essential procedures and care. We'll define the procedure, discuss the different types of catheters, and review the clinical contexts in which it is used. Urethral catheterization involves inserting a tube into the bladder via the urethra to allow free urine drainage or to inject liquids for diagnosis or treatment. There are two main methods. Indwelling catheters remain in place for a period, while intermittent catheterization means the tube is removed immediately after draining the bladder. Common types include the Foley's catheter for indwelling use, the Robinson's catheter for straight drainage, and the suprapubic catheter, which is surgically placed above the pubic bone. Next, let's review the clinical scenarios where catheterization is necessary and when it must be strictly avoided. Indications include managing neurological conditions, chronic urinary retention, outlet obstructions like an enlarged prostate, and monitoring urine output during critical care or surgery. Catheterization is contraindicated in cases of suspected urethral trauma, indicated by blood at the meatus, pelvic fractures, or a scrotal hematoma. A sterile field is essential. Key equipment includes the catheter, sterile dressing pack, drapes, water or saline for the balloon, anesthetic gel for lubrication, and a urine collection bag. Let's walk through the procedure, starting with essential preparation steps. Preparation involves verifying patient identity, explaining the procedure, checking for allergies, proper positioning, and establishing a sterile field using hand washing and sterile drapes. Maintain strict asepsis throughout. Cleanse the perineal region with separate cotton balls and apply anesthetic gel, such as xylocaine, to the catheter tip for lubrication and comfort. We now move to the critical steps of insertion and securing the catheter properly within the bladder. For female patients, insert the catheter approximately 5 to 6 centimeters until urine flow is achieved, then advance it another 3 to 5 centimeters to ensure it's fully in the bladder. For male patients, insert the catheter until urine flows, then advance it further, almost to the bifurcation, which is crucial before inflating the retention balloon. To secure an indwelling catheter, inflate the retention balloon with sterile water or saline. Ensure the patient is comfortable and the catheter is correctly positioned before documenting. Understanding the risks and complications associated with catheterization allows us to take proper precautions. The most common risks include infection, which can lead to sepsis, urethral injury, skin breakdown, and, rarely, long-term risks like bladder cancer. Prevention is key. Maintain strict hand hygiene, keep the drainage system closed, encourage at least 2 liters of fluid daily, and use the smallest appropriate catheter size. Finally, always document the procedure immediately in the patient's records, including the catheter size and type used. Thank you for watching.